I had no insurance, and these people still took me on. It was really bad because, I mean, look at what I went through, man. I'm serious. I couldn't even hardly walk. You know, I barely taking baby steps. You know, my self-esteem was getting shot. But these people were telling me it's gonna be all right, Carlos. We're gonna make this happen. We're not gonna leave you like that. You know, we're gonna make this work. You know, and they did. It was awesome, just an awesome, you know, feeling that people do really care about you.
The specialty clinic grew out of a need for specialty care in King County. Up until the last few years, there was no place for a community health primary care physician to refer a patient for specialty care.
And the larger effort was really around how do you provide more specialty care, but also the continuum of care that's associated with successful specialty care. We tried to create a place, a view, a philosophy, an approach to these underserved people that would allow them to get the care they needed in a very responsible way. Certainly, the administration had faith in our efforts. Our foundation had faith in our efforts.
So we brought together the Swedish physicians, we brought together community health physicians and the clinics, we brought together Project Access.
The Swedish quickly saw the value something like Project Access Northwest could add to their mission by allowing them to see more patients more efficiently and spend less money doing it. The folks that we work with are all low income, most of them are uninsured. They get their primary care in the community health centers, which do a fabulous job with primary care services. When those patients need access to specialty services is when they access a service like Project Access Northwest.
If you have bad oral health, it's a cinch that the rest of your health is going to deteriorate over time. And this was a real conundrum for us until we decided that we should have a dental clinic as well.
The dentistry program at Swedish started about 5 years ago when we started a hospital dentistry residency program. When the administration was building the SDSC clinic, they came to us and said, you know, we have a little bit of extra space. Would you have any use for dental services there? Would there be any way that we could incorporate that? And that got us to brainstorming, and we came up with the idea of an extraction clinic. The type of services we provide are often very difficult, complex extractions. So these are the ones that your average general dentist wouldn't feel comfortable doing in the community clinic system.
We tried to create something where everyone was a winner. The hospital is a winner because we managed to save $9 million in less than 2 years. $9 million in less than 2 years. By keeping folks from the emergency room and putting them in the right place of care. If you can find a way for all these parties to benefit, that not just social justice is sustainable, but Swedish is sustainable, and those patients who otherwise would be miserable, their health will be more sustainable.
From 2009, we had a handful of physicians who were helping us establish the clinic, and now we're up to 300 specialists within the Swedish system who either are available to consult in the clinic or they will do surgeries in the hospital. People started coming out of the woodwork saying, how can I participate?
The doctors are able to come in, do their consults or their procedures, feel like they have done what they were trained to do and love to do, and they're on to the next thing. We take the administration largely out of their hands. We provide the insurance. We do the paperwork. We provide the environment.
And every clinician that I've met with in Project Access went to medical school to help people. This clinic lets folks remember why and lets them just give back in a selfless, altruistic way that feels good in their soul.
I believe things like this specialty clinic are ways that we can represent real momentum, ways that we can represent success, ways that we can represent hope.
One in 4 girls and 1 in 6 boys have suffered sexual abuse before they're 18.
The vast majority of the people involved are ages 3 to 9. Imagine that, 3 to 9. These children need to be made whole insofar as it is humanly possible. You never have a second chance to start healing that child if that child is not handled at the very first interface in a humane and sensitive fashion.
There was a need recognized in this community for a place for children who had suffered sexual abuse to have medical evaluations in a more coordinated way than had ever had been possible. So a social worker named Melissa Allen at St. Peter Hospital took it upon herself to organizing a sexual abuse clinic for children, and she did that very effectively.
I took over management of the program in 1997. At that point, it was still just the Providence St. Peter Hospital Sexual Assault Clinic without partnership in the community. And one of the things that most of the staff said to me, including Dr. Deborah Hall, the medical director, was we need relationships with the community. We need to get a better relationship with law enforcement. We need to work more closely with our prosecuting attorneys. And that set my path.
Jill talked to me about a conference that she'd had recently been to that talked about this idea of child advocacy centers and the concept of creating a collaborative, co-located work environment where professionals come together into one place and work together as a team to address these cases. And it turned out to be really a perfect partnership because I could bring the criminal justice people to the table, prosecutors, law enforcement, and probation officers and so forth.
And indeed, we were able to make that transition within 2 years to the Monarch Children's Justice and Advocacy Center.
And so now, after all that evolution, this clinic provides services for children from the Southwest Washington region for sexual abuse evaluations and for physical abuse evaluations. Over the years, we've added on the sexual assault nurse examiner program to respond to emergency room calls for adolescent and adult victims of sexual assault, to provide the acute medical care and forensic evidence collection.
When you work child abuse cases, they can be incredibly taxing on a person. We have lots of concern about vicarious trauma. One of the best outcomes of this particular innovation is the support that it gives to these individual professionals who come together. So it's not only helped the kids and the victims, but it's helped the professionals better cope with these cases.
One of the hardest things about trying to do this work are the limited resources. Our state does provide some funding, but it's inadequate funding. It doesn't cover our costs. Our hospital's foundation has really been a major help for the last 6 or 7 years. They've provided a substantial amount of grant money, and which has really helped keep us in business. This work is very important for this whole region of the state. This is not just me doing this work. This is our team here in this clinic. We have a very strong, very dedicated, skilled team who really want to have good outcomes for the children who come here. That's how it works, and it needs to continue to work in that way for us to be sustainable.
How can we not, in Providence, come together and support a structure that is trying to heal those fragile souls?
The Global to Local initiative started with a conversation, talking about ways that we might learn from the work being done overseas that could improve our healthcare system here.
I see Global to Local as a collaboration amongst 4 organizations, all with the goal of helping the health of a community improve.
We're at a point in healthcare now where we know the old model cannot sustain itself. And we asked ourselves simply, why haven't we ever combined the remarkable innovations that we've taken to developing nations and bring them home?
The idea is a simple one, which is let's take what works in other places and apply them here. But it's interesting in that it hasn't happened.
Seattle and Washington State are considered the nexus of global health activity in the world. And to me, it would be the height of irony that we are improving lives so dramatically in other places in the world, but ignore what's happening in our own backyard.
Literally 5-10 miles from downtown, we have communities that have health statuses on the level of communities in Africa.
The realization that some of the greatest disparities from the wealthiest and the poorest in our nation can be found in South King County was a full indication that we were on to something important. The particular community that we're focusing on in the area of SeaTac Tukwila is largely at or below the poverty level.
The most diverse zip code in the entire country is just a couple miles south of Seattle.
The SeaTac Tukwila community is a very vibrant community with a whole lot of energy, and a lot of that energy is focused around the need for its own community development.
The local governments of SeaTac and Tukwila are as good as they come.
So a key part is engaging community-based organizations, engaging the leaders, the drivers that can make things happen.
The communities we take care of have real disproportionate share of chronic disease and lack of access to care, and lack of access to other kinds of public services that many of us take for granted.
You really can't eat well if you don't have healthy food at your corner grocery store.
You'll see people walking along the edges of the roads. People walk miles to get to the grocery store or to get their kids to school.
We see the problems that are caused by social inequity every single day.
So our job is to try to create a systematic approach that allows these people to become successful. Our idea was that we would create an initiative. Now, this initiative doesn't have 4 walls at the moment.
This program is truly in evolution.
It's a lot more creative than one might think when one hears the word entity or organization.
This is a truly holistic approach. You know, traditionally we think about having to go to a doctor's office.
Care is a very broad concept.
Whether that is physical health, mental health, economic health, educational health.
Most people think about great health care as technology, a big CT scanner.
In some ways, that's constrained us all into thinking that anything health-related needs to go through a hospital or a highly expensive healthcare system.
We anticipate that we'll be applying some of these global health strategies that we know work in other countries. Things like community health workers. We have people within the communities who can act as ambassadors and educators about where to get services or what types of services you might need. High-tech interventions as well, mobile technologies. We want to educate young people so they can help educate their parents. It's important to think about economic stability, housing and transportation, better nutrition. All of those are components to improving health outcomes.
When we look at bringing global to local, it doesn't mean coming in on a horse and saying we've got all the answers.
We have elected to take the broadest possible notion of what care really means and put our ideas to work.
This project isn't a one-way street. This isn't just about public health in Swedish and the Global Health Alliance and Health Point helping this vulnerable community. We will learn so much from them as well.
When one looks at indicators of need in various communities, they are statistics. When we engage with the people in our communities, those statistics come alive.
To me, this represents simply the most important thing that I've done in a long time.
Not only will it benefit these individual communities, but really has the potential to serve as a model.
It's a great thing to make people better, to raise the health status in their community. But quite frankly, it's the way out of our trillion-dollar mess in healthcare.
We have so many people who are invisible, and it's essential that we do something about it. This is all about the rising tide lifts all boats. The more that we can help people help themselves and do well by doing good, we all win.